Hello, everyone, and welcome to a Wednesday. It's a Dr. Jess Trimble day. Welcome back, Jess.
Thank you for having me.
And I'm Kelly Baltzell, and I'm the CEO and owner of Beyond Indigo Pets. We love Wednesdays. Well, one, because Jess and I are friends, so it's always just fun to be with a friend and see smiles. But number two, we are also girl geeks. So we like talking about technology. We like talking about telehealth. We like seeing what's out there. And Jess has some new things to talk to about us today. So Jess, take it away. And you still have a puppy at your feet, so he may join.
Yes, hopefully he seems to be passed back out that suddenly again. So hopefully he's quiet for this. But today, actually, we will be talking about point-of-care diagnostics. This is something that I was particularly passionate about when I was working doing house calls, because point-of-care diagnostics in a house call setting especially are critical to be able to get the information that you need in a timely manner. But we'll backtrack a little bit here. So if we think about how diagnostics are done, and when I'm talking diagnostics, I'm not talking about imaging diagnostics, but rather blood, urine, other bodily fluid diagnostics. And so it used to be that you would pull a sample. Typically, you would need a large amount of blood. It would have to go in 6 different kinds of tubes. Each tube has a different additive into it to allow the machine to properly read or to bind a certain thing in the blood to be measured. You would ship it off on ice to a lab. Once the lab receives it, they go through all of their stuff. And so it used to be a 5 to 7 day process. More recently, it's more like as quickly as 24-hour, but typically more like a 2 to 3 day process. There are some tests that still take a couple of weeks to get back. But what's happening is that as we research diseases more and more, and we're figuring out what exact little enzyme pathways or what exact electrolytes respond in certain ways, we've been able to develop tests that allow us to test much more specific things and thus get answers that much more quickly. And so if you look at the pictures on the slide, don't know if you can see them or not, but the point-of-care diagnostics that you typically see in a clinic are these blood machines, which would fill the entire desk space that I have, and then some. You've got a big one for your complete blood counts. You've got a big one for your chemistry panel. You've got a big one for your analyses. You might also have one for reading SNAP tests, like heartworm tests, things like that. And even with that, there's a large number of tests that you still have to mail away. And so while this is, having this is far better than having to mail everything out, they're clunky, they're huge. Don't even get me started on the cost of these things, not just the cost of the machine, but the cost of the little wheels that you have to put in for them to run. And then there's the cost of the contracts with the companies themselves. It can be really confusing, really laborious, really pricey. And so over these last few years, specifically in the human space, these point-of-care diagnostics really became more of a concierge sort of thing. I can come to your house and do your diagnostics right there in your home. But as most things happen, they start off more expensive. You have your early adopters take them in. And once they figure out what works and what doesn't, things get cheaper, things get faster, things get better. And then the rest of the population has access. And we're starting to see that with a lot more of these tests now. So if we go to the next slide, there's a few companies with a few different types of tests that I wanted to go over. The witness tests, I actually have a box of these in my closet right now because when I went home to see my family, I could then heartworm test all of my parents' and brothers' dogs for $4 a dog. Nothing had to be refrigerated, and I had all of the results in less than 8 minutes. Super, super easy. So compared to the old style of having to mail these away, now what we've found is you can do these tests, and sure, it's definitely better for the dog, better for the pet in that instance, because you have that test result immediately, but it's also better for the pet owner, because before it was, hey, I'm going to draw a drop of blood and then we're going to go in the back and some sort of magic happens. They don't really know what happens. With these, you can put the drop of blood on it right there in front of them, right there in the exam room. They can see that test working. They can see the value of that test in that moment. And so this really increases the perceived value of testing when you can actually have the pet owner involved in the whole testing process and they can see it happen. And so there's some interesting research that was done. I believe Abaxis did it, where they showed the difference between point of care testing and mail-in testing. So they asked these pet owners a variety of questions. And I want to say it was somewhere between 50 and 70% of pet owners said that all other things being equal, if a veterinary clinic had point of care testing, they were 50 to 70% more likely to choose that clinic over one that did not use point of care testing. So sort of interesting that, it's becoming more and more expected in all parts of people's lives to have results immediately. We have now more generations that are used to having it and having it now. And so this lends toward that, but in a different sort of way in that we can have incredibly accurate test results and have them in a really short amount of time. So heartworm tests are one. The Freestyle Libre is a really cool example of point of care testing because it really takes something that was incredibly painful for the pet, for the veterinarian, for the pet owner, and has made it incredibly easy. So diabetes testing for dogs and cats, typically we test their blood sugar once, oh, it's too high, but you can't really just give them insulin and say go, because blood sugar fluctuates greatly through the day depending on when they've eaten, when they've exercised, just like with a diabetic human. And so we have to do these things called blood glucose curves, where you take a blood sample every 30 minutes to an hour throughout an entire day so you can watch and see where those peaks and troughs of blood sugar are to know how certain doses of insulin drop the sugar and how a meal raises it back up so you know you're on the right dose. But the problem is that blood sugar also increases with stress. So taking a dog that's stressed out at the veterinary clinic to a veterinary clinic to have serial blood sugars done really doesn't result in great and accurate information. So what this can do is this little Libre attaches to skin on the back, and it actually reads the blood sugar in the interstitial fluid. And so it's kind of the fluid that's within your skin. It doesn't really need direct blood. So they're really pretty comfortable to leave on. And your veterinarian can put that on. They can put like a little piece of tape over it. You leave it on there for a couple of days, and voila, you now have incredibly accurate blood sugars while the dog is at home over multiple days, and you now have incredibly accurate information. It's fantastic. They're still working on it with cats. Cats, as always, are a little bit more difficult than everything. But this will really revolutionize the way that diabetic patients are handled because now the pet owners can do everything from home. Other cool ones that I'm pretty jazzed about, two together, RapidFact and Petgnostics. So this would be point of care for urinalyses. Now, Petgnostics has been around for a while, but what they did that's cool is they made a very simple diagnostic test that typically only veterinarians do. They made that available to the general public. And so some veterinarians aren't a fan of that. I'm a fan of it because I see it's more of a market expander, right? Because now somebody who maybe never would have taken their pet to the vet now can do this little test and go, oh, this isn't right. This definitely shows that something's off. Maybe I will go after all. It's just that extra confirmatory step to help them realize that their pet needs care. And so you can get this off of Amazon, and all it is a urine test strip that normally we would have it in a strip and you would dip it into some urine. What they've done is they have the pet owner catch urine in a cup, and then the lid has the test in it, and they just invert it, and then they let it read. They can take a picture of it with their cell phone, and then the app will tell them what is normal and abnormal. Now, granted, these are not, tried and true, incredibly accurate results, but they're going to be accurate enough to tell you, yeah, we need to get this checked on, or no, this is probably fine. There are some things that aren't super accurate though. So like leukocytes on this, so white blood cells, aren't super accurate for pets. They're more accurate for humans. But what we can do then is use something like the RapidFact. And what this does is it tests for urinary tract infections, sort of in the same style as a pregnancy test. It's like a one-line you're negative, two you're positive sort of deal. So it's not going to tell you how bad something is, but it can tell you yes or no an infection is present. And again, this can be done in home with just a regular urine sample. And so the really important thing with this is that previously, the only good way to diagnose a bacterial infection in urine is to actually look at the urine under a microscope and see the bacteria, or take some urine and put it on a plate and stick it in an incubator and wait 48 hours and see what bacteria grows. And so while RapidFact is more of a yes or no and not here's the different types of bacteria you have, it's again a really easy first step to allowing pet owners to understand if something is wrong or not with their pets. And the last point of care testing that I'm getting pretty excited about is by a new company called Cluej. And I've sort of been talking with these guys and following them for, gosh, it's been like 2 years now as they've been developing things to get them out on the market. This is a couple of veterinarians that actually came from a larger pharmaceutical company that developed tests. And they too decided they wanted to make something that was directly available to the consumer. Because again, we are seeing obviously lots and lots of pets coming into veterinary clinics, but there's still tens of millions of pets that get no care, that never get a stool test, that never get a blood test. And so if they can just pick this up on Amazon and do it themselves, at least their pet's getting some care. And if this comes back positive, they can share these results with their veterinarian, any veterinarian, so that they can then get proper treatment. And I really love this one because it is founded by veterinarians. They're using really solid science to ensure that they're doing this the right way. So the folks from Cluej, I know, are pretty excited about expanding this once they see where this goes, maybe doing urine testing and other types of testing. But I'm a pretty big fan of this direct-to-consumer point-of-care testing idea because I think it's really going to expand care to these pets that otherwise would not be receiving any testing whatsoever. So those are sort of a few of the companies in the veterinary space doing point-of-care testing, but more and more are popping up pretty rapidly. This is a space that's really evolving, and I'm really particularly interested to see how we can start to use this with telehealth. So for instance, a dog comes in and someone says, hey, she's peeing a lot more than normal. What do I do? I might be able to say, go to Amazon or go to your local Target and pick up one of these tests, and we can see whether or not your dog actually has a UTI, all without going to the vet, all without doing the traditional, more expensive urinalyses. So again, it's really going to expand care to pets who haven't had it before and increase, or I should say decrease the amount of time it takes to get these tests back, thus better patient outcomes, happier pet owners, the whole 9 yards. So let's keep an eye on the point of care diagnostics, because I think over the next several years especially, we're going to be seeing more and more of these.
I love new stuff, because with a human, I can go down to Walgreens and see if I have a UTI. At least a starting point, may not be my end point, but it's a starting point, right? To have more control and more things like you said. The adaptation rate is going to be interesting, especially after this year, because, I was researching something. Google said the last 6 months, we've done more change than in the last 10 years. All just smacked down into 6 months, right? Yeah. And so that has done something to our brains. What? I don't know. That'll probably be some graduate student's problem down the road, right? But it's done something. And will that make us as humans more adaptable to change or less? I don't, again, have that answer, right? We may just be so done with it, give us consistency, or we'll be like, yeah, after COVID, this is, a new thing, my care day, sure. Well, yeah, what? That no matters, right? I don't know where the chips are going to fall on this one yet, but it's interesting because it certainly opens the discussion point for new modalities and new ways of changing. And as COVID goes on, it may force us to change because some of us are not as adaptable or embrace change as quickly as others, and that's okay because we all have our way of processing, and not one way is wrong. It's just if you're a slower processor, life moves faster than you, it could be painful, right? And it's just the way it works. So I don't know. I'm excited to see what energetic, creative minds come up with through all of this, because we're already changing. I mean, everything is changing, how we're doing different processes. I mean, just like World War II changed us, going back to that, right? Like society was not the same after World War II. It just could not hit the switch to go back on so many levels, you know?
I think the same here. Society will not be the same after this. And there will be a lot of things that we never really go back to. You know, maybe we'll have finally realized that it's a bad idea to have 100,000 people packed into a very small area, or, you know, other more health safety measures I'm hoping will stick. But this is one of those things that, you know, if we do have a second wave, if we are all quarantined and people can't get out to get care, point of care diagnostics are going to be the only way that some people can get care. So yeah, it's really going to push acceleration of some of these technologies. And you're right, it's going to be some brilliant young grad student somewhere that figures it out. It won't be me.
No, because you're like, you know, that takes a lot of energy. Yep. Mm-hmm.
Yep.
Yeah.
And I have no energy because all I'm doing is chasing a puppy.
Which who knew 4 paws could take so much energy, but gosh, they're fast little buggers.
They are, especially when they have something in their mouth that they're not supposed to.
And they know it, even more so, right?
Yep. Oh yeah, I threw a couple of pictures on. One, because we've talked about my garden so much this summer. Here is my garden covered in snow on September, what day was that? It was 2 weeks ago now. We got 4 inches of snow, and incredibly, most of my garden survived. The tomatoes are doing great. Only the cucumbers and the basil really bit it. And there next to the garden is the creature who's now 15 weeks and almost 30 pounds. So he'll be an easy 60, 65 pounder, I'll bet. Yeah.
4 paws of love right there.
Oh yeah, and he loves helping me with the garden. He knows when I'm harvesting things that I'll pass him stuff too. So he's pretty pleased with that.
I had a neighbor's cat one year help me harvest raspberries, unbeknownst to me. I was putting raspberries in a bucket and I was just in the zone. And then I looked down and saw the cat eating all my raspberries. And he looked up at me like, what? Like, this isn't for me? And I gave him the rest because cat slobber on raspberries on cereal just didn't have the same appeal for me. But he was so ninja cat stealth quiet, and she was just sitting down there and just eating away. I'm thinking, this is the best day ever. Like, she's even picking the high ones for me. And oh my gosh, it was hysterical. Just the look on her face, like, what? This is my just due, right?
Typical cat, yeah, thinking that you're doing that for her. That's
right.
Weird. Yes.
It was awesome. Well, thanks for sharing today, Jess.
Oh yeah, thanks for having me as always, and I'm sure we'll see you next week.
Sounds perfect.